I'm Dr. Robert Lucia, board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about some of the initial instructions for blood sugar monitoring if you have gestational diabetes. Now, they're similar to if you have type 2 diabetes, but I assume if you have type 2 diabetes, meaning you've had it before you're pregnant, you're already monitoring your blood sugar and you're aware of how to do this. And if you're type 1 diabetic, the instructions are different, and hopefully you're paying close attention on a good glucose control. Please watch my other video for those. But if you're newly diagnosed with gestational diabetes, diabetes of pregnancy, then you're probably unfamiliar with how to monitor your blood sugar. And your provider, your physician, will give you detailed instructions, and they may vary a little bit from the instructions I'm giving you here. But these are some general guidelines that I use. So initially when we start out, depending on, you have a glucose tolerance test, and then you have the 3-hour glucose tolerance test, and depending on your values, you may be started on a diet, and you may be started on a diet with medicine, including metformin or insulin. Insulin injections are the standard of care. However, metformin orally taken is more commonly used now because it's a lot more convenient to take a pill than it is to take injections. But you may need a combination of those, so you're going to talk to your provider. So generally, when you start the blood sugar tests, you'll be asked to do a fasting, which is when you wake up in the morning before you eat anything, and then 1 to 2 hours after meals. And you might be asked to do it generally in the beginning, depending on your risk status and how far off your levels are. I might tell you to do it 4 times a day, so fasting, and then 1 to 2 hours after every meal. And in general, you want your fasting to be under 100, and you want all the other values after the meals to be under 125. There is some variation of that. Your provider might tell you 120, they might tell you 130, they might give you different fasting cutoffs under 95, but let's just make it simple for now and say 125 for all values and 100 for the fasting. And generally when I start a patient out on that, I like them to record it for a few days or a week and then follow up and hear a follow-up on those values. If you have a couple of values a little bit up, 30, 35, no big deal. You're getting all values. Let's say the fastings are 110, 120. Let's say all the other values are 150, 180, 200, 210. Don't wait the whole week. After you get a few of those couple of days, you need to be calling your provider and say, hey, my sugar levels are this. I need to give you the data, and then generally that's when we say we're going to need to start you on medicine. If you haven't already, that would be again metformin or insulin. Okay, so it's the accumulation of values over time. That being said, let's say you're on the diet, you're checking yourself regularly, and all of them are in that time frame. Then over time, I start to taper to spare your finger. It's no fun to stick your finger. So I might tell you, depending on your risk factors, your weight, your history of prior diabetes of pregnancy, I might tell you to do it every other day. Or I might often tell you, if your values are good after a few days, to start rotating it. So do a fasting and then do it after 1 meal a day, but rotate that. So after breakfast one day, after lunch one day, after dinner one day, and then slowly even taper it. Well, if you're doing well with your blood sugars. You should be aware that even if you're doing everything right and you're doing well with your blood sugars, as you get further along in pregnancy and as your weight goes up and as the baby grows, you may encounter a problem where your sugars go up and you might need a medicine later. It's not something to take personally. It is part of the illness that no matter how good you do, sometimes it is not able to be controlled with diet alone. Okay, it's also really good. You can look at my video on eating healthier for diabetes. There's lots of information out there. It's pretty short, but the general gist of it is eat natural things that Mother Nature makes instead of concentrated, highly processed fast foods and like sugar, candy, stuff like that. Eat fruit and vegetables. Very, very simple, not always easy to do. And also try to add a little bit of exercise. So after you eat a meal, just a little walk, 10-minute walk can make quite a difference. And regular exercise is real good during pregnancy, but if you have diabetes in pregnancy, combining that with meals can help you quite a bit. So I hope you found this information of use, and please get details from your own physician, but this is a good general guide for you. Thank you.